Hello everyone, as Eli mentioned, I am Marlé and thank you for joining us tonight. We are here to discuss a topic that affects many families and that is addiction. When our loved one struggles with addiction, it impacts the entire family, and that's why we say addiction is a family disease. So it is easy to focus all our attention on helping that person, but we shouldn't forget that it is important to take care of ourselves as well. So tonight we will explore why self-care is crucial for families affected by addiction and how it can help us maintain our own well-being during these challenging times. So in tonight's PowerPoint, we are going to focus on what self-care is. We're going to focus on why it's important and what may happen if you neglect your self-care. We're also going to look at a few myths and facts around self-care. And then lastly, we are going to discuss the different types of self-care that we get. Okay. So, self-care, as I mentioned, is vital for everyone, but it becomes especially important when dealing with the stress of a loved one's addiction. So, proper self-care allows us to maintain our physical and mental health, providing the strength and resilience needed to support our loved ones. Without self-care, we risk burnout, chronic stress, and a decline in our overall well-being, which can make it even harder to be there for our loved ones in a meaningful way. So, self-care is defined as the practice of taking action to prevent one's health, okay, or the ability of individuals, families, and communities to promote, maintain health, prevent disease, and cope with illness, as stated by the World Health Organization. So self-care is important as it ensures personal development in order for one to realize the comfortability in your daily life. It maximizes our personal happiness. Self-care gives us the advantage of bouncing back and re-examining our priorities. And then lastly, self-care is important as it sets certain boundaries that will greatly help us in the future in retracing our steps, remembering who we are, and above all, love ourselves. Then, self-care helps with the following. Okay, if you are not practicing your self-care, it may lead to stress, which is a state of a mental strain. That's what stress is. It can lead to burnout, meaning it is a unrealizable slow degradation of one's ability to emphasize with other people. It can affect your compassion fatigue. So, compassion fatigue refers to a sense of helplessness, confusion, and isolation, which at times may be disconnected from specific triggers. And then, lastly, vicarious traumatization is an imaginative feeling of being completely stressed out. We can go on to the next one, Cheryl. Okay, so myths and facts around self-care. So over the years, we've seen a steady increase in mental health awareness. So more and more we're hearing and talking about well-being, mindfulness, therapy, stress management, and self-care. So while it's all exciting to see this increased interest in mental health, um, the popularization of wellness can sometimes lead to misinformation and the desire to profit from it. So that is we call that wellness washing. So while taking luxurious baths can feel great, self-care goes far beyond just that. So true wellness requires more than skincare serums, kitchen gadgets, scented candles, and You don't always need to spend money to feel good. So self-care is quite literally taking care of yourself and your whole well-being. So to help you better understand what self-care is and isn't, I've laid out some popular myths and facts around self-care. So firstly, self-care is all about pampering yourself. So as I just mentioned, self-care is simply the act of caring for yourself. Sometimes that looks like sipping a tea with a friend with a face mask on, but it can also include creating boundaries, getting your heart rate up, or even paying your bills. The second myth is self-care is only for people with poor mental health. So self-care is for everyone. In fact, to an extent, you're already doing it. So even the most basic function of life counts as a degree of self-care. So if you are brushing your teeth, you're practicing self-care. If you've gone to bed early to get a good night's sleep, that's self-care. If you've sung in the shower lately, that can even be self-care. The reason self-care is more well known for those struggling with their mental health is because life's curveballs can sometimes make the most basic act of self-care difficult. Then you need to spend money to practice self-care. So that's a big no. If you feel you need to pay yourself a little bit more attention, self-care can be as simple as going for a walk or calling a friend. Buying that expensive pressed juice or downloading the fancy app might feel good in that moment, but it's not the only way to care for your health and well-being. Then self-care is only about taking care of your mental health. So when we think about who we are as people, we are complex beings, and there are many things that make up the self, so who we are. Think, think of all the things that make you, you. So self-care is caring for your mental health, emotional needs, physical needs, social needs, spiritual needs, um, practical needs, and intellectual needs as well. If you neglect one or more of these different categories, it can be difficult to feel balanced in your life. Self-care is indulgent and it's selfish. So the fact is, you need to care for yourself to be able to care for others. So it's not selfish to fulfill your needs. Blocking off time in your calendar for you, like me time, saying this is my time I'm going to spend with myself, is essential to avoid burnout, either professionally or personally. Um, we go by a saying that says you can't pour from an empty cup. So you will not be able to support your loved one in addiction if your cup isn't full. And then lastly, if you practice self-care regularly, you will always have a good mental health. So having a good mental health is not an individual responsibility. Yes, practicing self-care can boost your mood and it may help you feel better, but it is not a magical cure for mental health problems and illness. So fresh air is not a cure at all. Someone who is grieving a loss cannot shrug off their sorrow with scented candles or steamed vegetables. And baking a banana bread cannot erase the uncertainty and anxiety we might face. Cheryl, Ellie, before we move on, do you have anything you would like to add?
Yeah, I think you covered it beautifully. I think the last myth, especially, we always think that mental health is the absence of challenges, but it's not. Mental health is the ability to regulate, the ability to recognize how we, contribute to our own suffering, how we react or exist in relation with others. It's quite a number of things. It's not necessarily the absence of issues or challenges.
I definitely agree with you.
Yeah, I think what came up for me as you were speaking, Marlé, is the depths of denial that the family goes through. And this is one area that we're very quick to deny. Deny that we're struggling, deny that we're sick. I know families who postpone an operation because their loved one's going into treatment. I know loved ones who compromise physical health, mental health, financial life, anything, and they put the addict first. And I think, we cover this a lot, and there's a reason for that, because we want to avoid families burning out, because if the family burns out, what chance does the addict or recovering person have? So that's important for me. Sorry.
I hear you, Cheryl, and I definitely agree with this. The reason I like this topic so much is because it's one of the most important things you need to do for your own recovery, because believe it or not, you might not go through addiction, you might not be the one that's addicted to substances, but you also have a healing journey to go through. And this is part of that recovery journey. Cheryl, there we go. Okay, so up until now, it might have seemed a lot of information. Okay, there's so many categories: physical, emotional, mental. It's just so much. So you get this acronym, and it says PIES. So PIES stand for physical, intellectual, emotional, social, and spiritual needs and well-being. So in order for you to remember that you have different groups in yourself that you need to take care of, this is a perfect acronym that you can just remember. So think about it as eating a pie for your health. A good pie. Hopefully you'll remember this. Okay. Go to the next slide, Cheryl. Okay, so let's start with physical self-care. So physical self-care involves taking care of your body to maintain health and energy. So a few examples include to get your body moving. So exercise promotes that production of feel-good chemicals in the brain, which make us feel content. It also reduces the likelihood of an illness and certain diseases. You do not have to be a Zumba master or a bodybuilder just to get moving. So regular physical activities like walking, yoga, or doing a sport that you like is more than enough. Besides just going into sport or going for you also get the food aspects. So food is medicine. It fuels us by giving us or our bodies the nutritions we need to operate at maximum capacity. So one of the best ways to practice physical self-care is to eat right and to try and eat 3 meals a day. So eating a balanced diet, which includes like rich fruits, vegetables, and whole grains, is things that you might need to look at. And then lastly, with self-care or physical self-care, it also includes your health in your sleeping patterns. So getting a full 8 to 10 hours of restful sleep every night is critical to our physical health. So physical health includes moving your body, eating the best you can in a healthy manner, and trying to get your beauty sleep. Anything you would like to add before we continue?
No, not from my side.
Okay, then
Nothing on my side. I just want to ask if we can kindly just mute. There seems to be background noises. Please kindly mute. Thank you, family.
okay, thank you, Ellie. So then we move to emotional self-care. So emotional self-care is us acknowledging and nurturing our feelings. So you feel them rather than running away from them, if that makes sense. You talk about them with people you trust, and you develop healthy coping skills to manage your emotions effectively. So examples of emotional self-care includes things like journaling. So write about your thoughts and experience. Maybe you need to sit at night or can sit at night for 5 to 15 minutes and just write how your day was. What did you experience? How did that feel? What was your pit and what was your peak of your day? Another example of emotional self-care is maybe going for therapy. So speaking with a counselor or therapist. And then mindfulness. So mindfulness is practicing meditation or other relaxation techniques. By participating in mindfulness activities will also help your emotions. It will help ground yourself. So if you experience high overwhelming emotions, by doing grounding exercises, taking deep breaths, doing relaxation exercises, will help you manage or bring that high intensity emotion a little bit down. If there's nothing that you guys would like to add, we can move to the next slide. Okay, then we get mental self-care. So with the acronym we used, there is not a name in the acronym, but mental self-care is also extremely important. So mental self-care focus on managing our mental health and emotional well-being. So it involves practices that help us cope with stress, process emotions, and maintain a balanced state of mind. Mental self-care is about how you think, how you process information, how you make decisions. So there's a fine line between emotional self-care and mental self-care. However, there is a difference. So emotional self-care is more of acknowledging your feelings, nurturing them, not pushing them away. Where mental self-care, you focus more on how you process that emotions, how you will cope with stress, and how you can or maintain a balanced state of mind. So examples of mental self-care is to take a mental break. So for example, taking short breaks during your work, or if you need to study, take a break, take a little break to rest and rejuvenate the mind. So by taking mental breaks, it will help you prevent burnout and keep the mind fresh. Another example of self-care for your mental health is stress management techniques. These techniques include like deep breathing exercises, progressive muscle relaxations, or guided imagery. Anything that you would like to add? If there's nothing to add, we can move to the next slide. Okay. Then we get intellectual self-care. So intellectual self-care is about engaging our minds in ways that stimulate and challenge our thinking. So these activities involves ways that we can expand our knowledge and keep our cognitive functioning sharp. So examples of activities that include this is to maybe learn a new skill. So, for example, taking up a new hobby, learning a new language, or enrolling in a course that you find interesting. By continually learning keeps the mind active and it improves your cognitive abilities as well. Another example of intellectual self-care is reading. So reading books, articles, or journals on various subjects or subjects that you find interesting also contributes to you expanding your knowledge. So reading not only enhances that knowledge, but it also improves the concentration and mental and your mental capacity. Another way to spend time with your mental self-care is to like take out a puzzle or play a game. So, for example, engaging in activities like crossword puzzles, Sudoku, or chess. These activities challenge the brain and enhance that problem-solving skills that we need to require. And then creative activities. So this can include engaging in art and craft or even writing. So being creative, it stimulates that different parts of the brain and it fosters that intellectual growth. Cheryl, anything that you would like to add?
So I think, a good example of intellectual self-care is familiarizing yourself with the 12 steps, which we follow at our rehab center. And, when you familiarize with the 12, because the 12 steps are not just for the addicts, but the families as well, because addiction is a family disease. When you sort of become familiar with the content of what your addict is sort of internalizing and working through, you're able to reflect on yourself as well. Because a lot of times the addict becomes the identified parent, and we as the family sometimes think that we don't have any addictions or any issues. And part of self-care is going through that content so that we can recognize areas in which we are powerless. So step one, admitting that we are powerless and that our lives have become unmanageable.
Ellie, are you still there?
Ellie seems to have frozen, and she was on such a good path. So I'm not sure if we understand what her trajectory was, but, in talking about step one and admitting we're powerless over the addict and that our lives became unmanageable, I think is a very powerful part of self-care. To admit we're powerless means that everything I've tried and some didn't work, it can't work, and I have to do something different, but my life became unmanageable is what we're talking about tonight, where we neglect our needs, we neglect other family members, we neglect our health, we compromise ourselves, and that's the part of the work that we families sorry, I think we're all coughing as families have to do. It's no good just admitting I'm powerless. I have to look at my unmanageability. And how am I going to look at my unmanageability? These slides and the share tonight is part of that. I know for myself, when I used to be told you got to take care of yourself, I was like, I'll deal with that later. There's more urgent burning issues here to deal with. I've got to get him into treatment. I've got to go and have a family meeting. I have to go to the pawn shop and pick up the stuff that he's pawned. There was always something more important than what I should have been doing, which was taking care of myself. So I think it's a very difficult topic and thing for us to look at. And that's why we do advocate the 12 steps for families, like Al-Anon and Al-Anon, and then Narcotics Anonymous and Alcoholics Anonymous for the addict, because they've got to look at their powerlessness, they've got to look at their unmanageability. Theirs is a little bit more deep than just self-care. It's one part of what they have to deal with. They have to also get honest. I think the families have to get honest. And admitting the powerlessness is not easy. To say to somebody, your doctor, or, I haven't read a book in 6 months or a year. I haven't gone and done any exercise. I haven't cooked a proper meal for myself. Because if we really get honest, that's how we live.
Mm-hmm. We're always rushing. We can never just stop and breathe in and take a breath and think about what we need in that moment.
I think we as families of addicts live in a perpetual state of emergency. So we go from crisis to crisis, or rescue to rescue, fixer to fixer. And to step back, I don't know if we're capable of doing that. I think we have to crash and burn as well. I know many families who land up in hospital, funny enough, when their loved ones come into treatment, right? How many times a week do we hear, sorry, mom's been booked into a hospital, receiving psychiatric care, parents are splitting up, nobody wants to talk to us, they don't want to talk to their loved ones. And that's because we've dealt with state of emergency, crisis. And very often when you book your loved one into treatment, I think that's when we fall apart. And I think that's where maybe we can start looking at self-care. I know it was very difficult for me to do any self-care until the crisis was averted. And I think we do these workshops so that parents don't have to go through those cycles. We can bypass it for them by saying it's not selfish, it's not toxic, and you're not telling us you don't love your loved one if you're taking care of yourself. Getting a good night's sleep, doing research. When you were reading about research, it came to mind how many families will say to us, I've read everything there is to know about cocaine. And I said, that's good, but does that help you with recovery? No. You just know about cocaine. It's not going to help you get better, your loved one get better. Are you researching recovery? Are you researching 12 steps? Are you researching what does a family need for a loved one to get better? Stop enabling. Set those boundaries. That's what we should be listening to. That's what we should be researching, because that's going to help us get better, and that's self-loving.
Cheryl, I definitely agree with you on that.
Okay, next slide.
Next slide. Okay, we also get spiritual self-care or spiritual health, and I don't only see it in treatment with the patients, but I see it in society. When it comes to spirituality, it tends to become a very sensitive topic. So spirituality and the self-care around spirituality is very important, and it's just as important as your physical self-care, your mental and your emotional self-care, and intellectual self-care. And there are people that argue that this is the most important aspect of your whole self-care routine. So spiritual self-care it connects us to our deepest sense of meaning and purpose. Maybe you don't consider yourself a spiritual person, or perhaps you don't have a belief in a higher power, and that's okay. You don't have to be a Zen guru to earn the many rewards that comes with spiritual self-care. in the big book, the blue big book that we use in treatment, when it comes to a higher power and explaining that to the patients, it's believing in something bigger than yourself. So it doesn't mean it needs to be God. It doesn't mean it needs to be Allah. It's a God to your understanding. It's a higher power according to your understanding. So examples of how you can focus on your spiritual self-care is, once again, meditation. So meditation comes into emotional self-care, but it also comes into spiritual self-care. So spending that time in a quiet place where you can just reflect, or where you can just meditate. That is something that we as people struggle to do. And as Cheryl just mentioned, we are always on the go. What do I need to do for the loved one that's struggling with addiction? And we don't think about ourselves. So meditating and taking 15 minutes or 10 minutes where you can just spend time in a quiet place, maybe put on some music to help you calm yourself down, and just reflect on where you are in your day and what happened in your day and what you need moving forward. The other example of self-care or spiritual self-care is through prayer. So there is people that believe in God or Allah, and they use prayer to engage in spiritual practices. And another example of spiritual self-care that I think we tend to forget is nature. So spending time in nature to feel more connected to the world around you. So, like I said, self-care doesn't mean you need to have buy a lot of things. You need to spend a lot of money. You need to take the whole day just for yourself. If you can do it, great. But the reality is, most of us we can't just take a day for ourselves. So something as small as going into your garden and just looking around, looking at your plants, at the flowers, looking at the birds, just like exploring, what do they do? That is a way that you can work on your spiritual self-care. Cheryl, anything that you would like to ask or say?
No, well covered.
Okay. Then the next slide, we get social self-care. So social self-care is about maintaining and nurturing your relationship with others. It involves activities that help you build strong, supportive connections and foster a sense of belonging. Having a robust social support system is essential for emotional well-being, and it can provide a buffer against stress. So once again, there are different types or examples of different examples when it comes to social self-care. So one of them is regular meetups. So scheduling a weekly or monthly get-together with close friends or family members. By doing this, it's that consistent face-to-face interaction that's going to help us strengthen the bond and provide that emotional support. Another way of practicing social self-care is to phone or video call people that you would like to connect with. So in today's society, and I think after COVID-19, picking up the phone and calling or going onto video chat has become more of the norm, and we don't necessarily need that. If I want to speak to you, I need to go to your house and I need to have a conversation with you. I do think that is important, and that's why I mentioned the regular meetups, to have that face-to-face interactions. However, there are different ways to also connect with other people, and that is through phone calls and video chat. So calling or video chatting with a loved one who is maybe living far away. So regularly checking in with those you care about, even from a distance, that helps maintain that close relationship, and it provides that mutual support for one another. Another example of social self-care is through support groups. So attending groups for those experiencing like similar issues, such as addiction or grief or chronic illness. By attending these groups, it's a space where you share experiences with others who understand your situation and can provide that comfort, advice, and a sense of community. Recently, I had one of the family members from a patient we had in rehab come to me, and she told me that she enjoys these groups that we offer. And she said, yes, you guys learn new things about how to handle certain situations, what addiction is, what the 5 pillars are, and the list can go on and on. But she said what she mostly enjoy from this 6 to 7 on a Tuesday night is to just feel that I'm part of something, that I'm not alone. I'm not the only one that is struggling with a family member that is going through addiction. Another way is community organization. So participating in local like clubs, religious groups, a community service is also a way of social self-care. By being involved in the community, it fosters a sense of belonging and connection with others. And that is exactly what social self-care is that connection and that feeling of belongingness. And when you feel connection, feel you belong, ultimately they are going to become your support system. Those are the people that you're going to call if you are in a difficult situation, or you just need to speak to someone. Cheryl, anything you would like to add?
No, I think just the importance of that support. Wherever we choose to get it. I think whether it's from each other, family, coach, doesn't matter. We've got to talk it out. In the rooms of Narcotics Anonymous, we say secrets keep us sick. Or we're sick as the secrets that we keep. And if we talk to people more regularly, we tend not to keep that many secrets. Because when somebody shares some of their struggles, it's easier for me to open up. So, the social support is a sublime way of self-care. And, in NA as well, the power of one addict helping another is without parallel. And one family member helping another is without parallel. So very, very, very important.
Yes, definitely. Sitting here thinking about it now, social self-care and emotional self-care, I think to an extent goes hand in hand, because if you have that connection and the feeling of you belong, and you can talk about things in a healthy way, by doing that, you are also acknowledging your feelings. You're also going through what you're thinking, and by doing that, processing it through someone that's maybe just a friend that's listening. By doing that, you're also working on your emotional self-care.
And I think don't we think it chisels away at denial? because you're allowing somebody to challenge. And I think it's one of the struggles we have as family members, but when we don't reach out socially, is we're quite comfortable in our denial. And we don't really want anybody to challenge it because we yes butters. Yes, but, yes, but, yes, but. And that's social and emotional. Means that you're letting somebody in to say, you know what, your thinking's a little bit distorted. How do you okay the fact that you work 15-hour days and your loved one wakes up at midday and demands food? Excuse me, and you give it to them. Is that acceptable? Because deep down we know it. We just don't know what to do with it.
Yeah, that's true. I think we can move to the last slide when it comes to self-care. And through this PowerPoint presentation and tonight's topic, I did go through a few of examples when it comes to the different categories of self-care. But you have to be intentional about self-care. You have to make it a priority and set time aside to take care of yourself. And here you will see there's or just again a few examples of how self-care might show up in your life. So taking a hot bath, going on a nature walk, listening to your favorite song, enjoying a cup of coffee or tea with a supportive friend, maybe taking a mini vacation just to relax, meditating, praying, stargazing, to prioritize yourself, setting healthy boundaries. And I emphasize that that's a way of self-care. It's not always fun to set a boundary with your loved ones, especially your loved ones in addiction, because they tend to manipulate, they tend to take advantage of you. But setting that healthy boundary is not only for them, but it's also for you. Think about self-care like this. As self-care, it doesn't have to be this big thing. Like I mentioned earlier, it's not that you have to put a day aside and say, this day I need to do my self-care and I'm good for the next few months. So even a few minutes of self-care is better than doing no self-care. And keeping up with your self-care routine, even when you're feeling good, is where you need to focus on. Remember, this recovery journey is yours. You need to find what works for you. I might go sit in the garden for 10 minutes in the sun and feel a little bit better, where Cheryl might need to take a drive or drink a cup of tea. And that's her way of taking care of herself. So from my side, that is that. This PowerPoint has come to a conclusion. So in conclusion, self-care is not about luxury, but it's actually a necessity, especially for families dealing with addiction. By taking care of yourself physically, intellectually, emotionally, spiritually, and socially, we build that resilience that we need to support our loved one and maintain our own well-being. Remember, taking care of yourself and making or taking time for self-care is essential part of being able to care for others. So thank you for joining us today and tonight, and please take these insights to heart as you continue on your journey moving forward. Okay, that's all from my side. Cheryl, do you want to add something?
No, I'm keen to open it up. I'm going to stop the recording now so that people can feel comfortable to share things that might have come up for them or whatever is pertinent for today. So give me a
We
minute.
do have a question in the meeting chat. Trevor is
Okay.
asking, if a patient is on a supplement, is it a must to continue with it or not?
Okay, so I think my suggestion